And thanks for being here. My name is Steve Petty. I am the Executive Vice President of the Lynn Institute for Healthcare Research. Thank you for joining us for our Men's Health Talk. My colleague Steve Haynes will be hosting this for us. So if you have any problems, you can chat it and yell at him on the chat side. I'd like to introduce Mr. Greg Jones. He is the Director of Community Engagement for Centennial Health, and he is one of our partners with the Northeast Oklahoma City Healthy Community Collaborative that the Lynn Institute has done for the last 5 years. He is the co-chair for that group. I'm going to turn it over to Greg to introduce our guest speaker.
Good afternoon, and thank you. I appreciate that, Steve, for being a part of this discussion on today. It's my pleasure today to introduce Dr. Charles Lunn. Just a little bit about Centennial Health. We have 4 locations in Oklahoma City, Midwest City, Edmond, and now in El Reno. Dr. Lunn serves as a medical director for Centennial Health, has over 30 years practicing in family medicine. He is a proud, received his medical degree from the University of Oklahoma. All of us can say Boomer Sooners. He's board certified, American Board of Family Medicine. He has a lot of personal interests. He's a family guy, loves to fly fish, actually has his own band. So outside of work, there's a lot of things that he likes to do. Mainly, though, I like to say he loves to be involved and engaged in the community. So we are so happy and privileged today to have Dr. Charles Lunn Jr. with us today to really facilitate a discussion around men's health. Dr. Lunn?
Well, thank you, Greg. I'm going to wave because I just like the way my hand looks. That was a very kind introduction. I'm very glad to be here and talking to everybody. And as I understand, I'm going to give a brief kind of overview about my discussions regarding men's health with a little bit of a geared or bias towards men of color's health. So again, as Greg said, I've been a practicing physician with the Centennial Health for 30 years. I've been the medical director, been the medical director of an insurance company. I've also just in the last 2 years gave up my associate professorship at the University of Oklahoma's family medicine teaching 3rd-year clerkship. So I've been around a while. I've done a lot of things. What I'd like to start with is that when we start talking about men's health, the first thing is really, you don't talk about men's health, you talk about lack of men's health. And, you know, there's so many ways you can go into talking about lack of health access. Lack of health access has to do with payers. You know, do you have insurance? Do you have access to a provider? Do you have the time to go see a doctor? Do you know what you need to do? Those are really, really important things. Then you've got a lot of issues with fear and mistrust. And I'm going to try to address all of those as best I can. And this seems a little odd because I'm used to talking to people and then they answer me, but I guess we got chat going on. So anyway, so the first thing, men's health is, I always like to start up. My brother is a human resources director for a big company. And one of the things that he asks all his employees when he comes in, he says, can you break your job down to one sentence? I'm a primary care provider. My one sentence is, people pay me to do stuff they already know they ought to do. Somebody comes in my office and says, Doc, you think I ought to lose weight? And I go, yeah. Doc, you think I ought to quit smoking? Yeah, yeah. You think I ought to exercise? And, so most of all our health is basically upon ourselves to do the right things. It's hard to do the right thing. It's easier to do the wrong thing. One of the things that I see is a lot of people lean towards things that make them feel good immediately, which is the reason you have higher smoking rates in parts of the city that have higher stressors. Because when you smoke that cigarette, you feel slightly better. When you go to the convenience store and get that Twinkie, you feel better. When you don't exercise, exercise hurts. So those are some of the things that are obstacles to good health. But just to let everybody know, most of your good health regimen are in your own hands. If you have to think about it and go see a doctor to reconfirm what you already know, it's not a waste of money. I don't want to be broke, but it's a good idea to think about what you just lifestyle. First thing I'd like to talk about is providers. Now, when we talk about healthcare and seeing a provider, it doesn't have to be a doctor. I'm a full-fledged board-certified doc with all these accolades. Most healthcare does not have to be provided by myself. It can be provided by a nurse practitioner who can work independently. It can be provided by a PA. It can be provided by a nurse. A lot of health vaccinations come from nurses. Those are ways to access it because you're not going to see a doctor every time. How often should somebody see a doctor or see a healthcare provider for routine physicals? Well, when you're a child, you should see a doctor maybe once every 3 years, and that's till age 20 or in the 20s and 30s. In the 30s, it should be about every 2 years. In the 40s, it should start being every about once a year. And then in the 50s, like me, in 50s and 60s, it should be pretty much every year or every 6 months. That's just for routine checking on to make sure everything's good. If you have a car, as it gets older, you change the oil a little more often. So if you think about how often would I change the oil in this old car, that's about how you should see that. One of the big fears that I'm just going to break down right now, a lot of men don't want to see the doctor because they don't want to get a prostate exam. I'm here to tell you the prostate exam is out. It's been out for the last 4 years. It's been the best 4 years of my practice. We don't do routine prostate exams on people any longer because we actually started causing more problems doing that. For prostate health prostate health, really, you should do a screening test for high-risk people, and high-risk people are men over 40, smokers, African Americans, and Hispanics have higher rates. Family history. Now, if you've got a family history of prostate cancer, you may end up getting a digital rectal examination once a year, once every other year. But those other groups, simply a prostate-specific antigen or a blood test is all you need. So no more fear going to the doctor. I don't even know where I keep my gloves anymore because I don't have to go do that anymore. That's one way to get you out of that. Let me see. So let's talk about the big animal in the room. So I've already talked about the prostate. Now, people are afraid of prostate cancer, but prostate cancer is not nearly as deadly as we thought it was, especially when it's caught early. Most of our cancers are actually caught early. People worry about the odd cancers that just come up on people and kill them, but it's the routine things we worry about. If you're a smoker, you got to worry about lung cancer. If you're a woman, you have to worry about breast cancer. Men have to worry about prostate cancer. But the risk of dying from prostate cancer has gone down dramatically. Most people actually just live with prostate cancer. If you get to be age 70, you're more likely to die for treatment from prostate cancer than prostate cancer itself. So that's just a big old myth that we need to kind of get away from. The other one that most men are worried about is erectile dysfunction. My goodness, all day long, men are always worried about their nature. Erectile dysfunction, unfortunately, is normal once men get to be about 50. That's the reason you hear all these ads for low T commercials, things like that, because if you add testosterone, it helps men with erections. But we have to go back to, why do men have erectile dysfunction or dysfunction? It has to go with the lifestyle. If you start off not exercising, gaining weight, start suffering from diabetes, hypertension, erectile dysfunction is a natural course of life. So when I have men come in to say, well, you know, I can't do what I used to do, a lot of times it's not just that they're not able to get erections, they're afraid of not being able to get and maintain an erection. And once that occurs, we men don't like it, and we're scared. We're scared that the next time we won't be able to perform. That is what I see is a lot of psychological things with it. So now we're leaning on pills and shots and things like that to help us with that. A lot of men can go back to just the natural course of getting routine exercise, try to stop smoking. If you have underlying conditions, try not to make them worse. That's, for instance, diabetes and high blood pressure. But anyway, that's kind of what I just want to get out there, that it's not hopeless for us. So, again, what should a person do when they go see a doctor or a nurse practitioner? The first thing, you'll come in and you'll see the provider. They will do your objective measurement. Your first objective measurement is your weight. If your weight is up, and you know, every day people, you already know if your weight is too much. That's a measurement on health. The second thing they're going to do is they're going to check your blood pressure. Now, one of the problems I have is I'll see a lot of men who are athletes. I'm a former athlete. They go see the doctor when they're 18, 19, their blood pressure is slightly elevated. Then they don't see a doctor for 20, 30 years later. That's terrible. And then they're afraid they're going to get a medication for their blood pressure. You don't have to treat blood pressure with medication. You can treat it with diet and exercise, but you have to catch it early. Every time I see somebody at age 20 that their blood pressure is slightly elevated, it's like a cruise ship. I've just got to nudge it just a little bit. You say, your blood pressure is a little elevated. You know what? You know, I want you to get a little more exercise. I want you to lose a little weight. And guess what the next thing to do is? I need to check it. If you don't check it, you won't know. So we need, you know, if you see somebody and your blood pressure is slightly elevated, you need to make sure you have a follow-up with a provider. Another thing that we've got in America now is that we have this ability to check blood pressure at home through these digital blood pressure cuffs. I'm here to tell you those things are inaccurate, and they scare the bejeebers out of people. You know, it'll read their blood pressure at 200 over 120, and then they're calling me all night and all these things. Really, you ought to see somebody, a provider, to let them tell you what to do. Because if your blood pressure is elevated, you don't have any tools to measure. I mean, unless you're like me, I can write myself prescriptions. I shouldn't, but really, you shouldn't. You should see a provider to follow up on the blood pressure. The other objective measurement, you should get lab studies. And I'm just talking about age 40, because that's about when I'm really seeing people with problems. You should have your blood sugar checked, either a random blood sugar or a test called a hemoglobin A1C that shows what your blood sugar is averaging. You should have your cholesterol checked. You should have your electrolytes checked. You should have your PSA checked. A lot of men want to have a testosterone check. Okay, you know, people won't die from low testosterone, and you don't really have to treat it unless, like if you say we do a lab test and your testosterone is low, and if you're not having problems, don't worry about it. So, but those are the routine tests. I'd like to go on to just talk about a little bit about diabetes. And Greg, how am I doing for time? Am I okay? Okay, because I can wrap up anytime, or because I feel rambling. I feel like I'm rambling. So diabetes, just to break it down, diabetes means that your blood sugar is elevated. When we talk about blood sugar, we talk about glucose. Glucose, sugar are the same thing. Our brain only eats glucose. The simplest glucose or simplest sugar that we eat is fructose. Fructose is the sweet stuff, cake, candy. It's broken down really fast. So when you eat a piece of cake or candy, that's like gasoline on fire. It goes up real fast. Your blood sugar goes up real fast, but then it comes down real fast. A steak is closer to a log. It's complicated. It takes a while to break down. They all burn the same amount of energy, just not at the same time. Most of the diabetes that I'm dealing with is called type 2 diabetes. It's common among minorities. It's common at age 50. It's common in people who suffer from obesity. It's common in families. It is not a death sentence. In my particular practice now, every third person I see has diabetes. And I kind of love to look at my waiting room because 30 years ago, if I said that, I would look at my waiting room and I'd look at people with 1 foot, a white cane, and on dialysis. Now people are coming in with diabetes that I'm just managing with diet. And it doesn't have to be all that crazy. It can be just eating a little less of stuff that you know. Exercise, which is basically 30 minutes of aerobic exercise or a walk at least every other day. And then medication. And most of the medication is not insulin. Most of the medicine is just oral medications that people have to take once or twice a day. Most of my diabetics are not checking their finger sticks. Let me say it again. They're not poking themselves. They're seeing me about every 3 to 6 months. I check their blood sugar. Maybe I adjust the medicine. A lot of times I take people off medicines because they've changed the lifestyle, they've lost some weight, they're getting some more exercise. And guess what? Diabetes, as people get older, sometimes gets better. And I'm just going to end my talk before I take the chat and calls with just a couple of my personal pet peeves. My first personal, as a primary care doctor, my first personal pet peeve is I heard that this is bad. So I know where we're going with this. There's usually some medicine I'm giving somebody that somebody saw on the internet that is bad, or a vaccine. We've got a whole group of people not believing in vaccines. One of the problems I have with that is I don't get to treat smallpox anymore because we have a vaccine. I don't get to treat polio because we have a vaccine. I don't get to treat diphtheria because of a vaccine. When people say they heard a vaccine is bad, they're usually alive to complain about it. So I've got a real problem with people not saying, I'm not going to take this vaccine, and then come back, with the flu, and I'm trying to prevent them from dying. Anyway, pet peeve of mine. Second one is medications. Most docs have spent 12 to 15 years trying to know how to save somebody's life. We generally don't prescribe anything bad for people. So just, take that as a thing when somebody says, oh, I heard this medicine you prescribed for me is bad. It's like, that's not in my playbook to try and harm you. Okay. So anyway, Greg, we got Greg and Steve, do we have questions?
Yeah, we have one question. Dr. Lund, you mentioned before the tests that men should take on a regular basis. Can you repeat what those tests are again?
Okay, so if you're over 40, you should know if your cholesterol's controlled. You should know your weight. You should know your blood pressure. You should have your cholesterol checked. You should have a PSA, or prostate-specific antigen test. You should know if your glucose or hemoglobin A1C is controlled. And then generally electrolytes. Those are the baseline tests that you would get at the office. The other things, there's like a couple of screening tests that you ought to have. At age 50, you should get a screening test for colon cancer, And it doesn't have to be a colonoscopy. It should be. Colonoscopy is the best. But you can do a fecal occult test that you just put poop on a slide and mail in. If you do that every year, that is almost as good as a colonoscopy. And people shouldn't be really afraid of I hear a lot of people saying they don't want colonoscopies because this and that. I've had 3 of them. I'm good, and I'll just tell you a personal thing. I got my colonoscopy first when I was 51. I was a little late. They found 3 precancerous lesions. They removed them. Now, I could have kept those, and now I'll be 59. They would have just about bloomed now, and I'd have colon cancer. So the good thing about getting colon cancer is you lose weight. Bad news is you die. So colonoscopy screening, that's the reason I'm here sitting there telling jokes to you guys. Any other questions, Greg?
Doctor, before you move on, can you talk a little more about the colonoscopy? At what age? I think you said 50, but if there's a family history, and I'm just thinking for some of my cousins and stuff whose fathers had that, what age should they, if there's a history from, is it a grandfather or father that they should have it earlier?
They should have it earlier. Now, what you talk about is first-degree relatives. First-degree relative would be a father, not a grandfather, or a son, or maybe an uncle. And we do them as early as 35 in people with family histories. If you have a very strong family history. When we talk about family histories, a lot of people say, I have a family history of cancer. That's very non-specific. When we talk about diseases that run in families, like prostate cancer, if your uncle, your dad had prostate cancer, you got to watch out for that. Same thing about colon cancer. If your father, mother, aunt had colon cancer, you need to get a colonoscopy. I'll tell you another issue then personally. I've got a family history of colon cancer because I found that I had some colon cancer. I had a cousin, great guy. I told all my cousins, hey, you need to go get your screening test. This is where insurance is so important. My cousin didn't have insurance. He couldn't get the test. We buried my cousin last year. So that's the importance of having access and going to a doctor. He had a preventable disease that I, as a doctor, had warned him about and warned everybody about. But it's not like he didn't want to go get a test. He just couldn't because he didn't have insurance. Yeah.
So another question, Doctor. As far as where we could refer people to that don't have these, where are some of the places that you would recommend that people that may not have insurance, and do you have resources that you like to recommend?
Well, I'm unfortunately, we run this clinic here, and so most of our patients have insurance, but the insurance that we deal with is we're probably going to expand Medicaid. Mm-hmm. That's a good way to get insurance.
Right.
If you can do it, Obamacare is a good way to get insurance.
Mm-hmm.
Variety Care in the city does provide health care for a very reasonable price. And if all else fails, you can go to the screenings, like the prostate screening test things, and you can donate blood. When you donate blood, they will check your cholesterol, check you for anemia, check you for HIV. Now they'll check you for COVID, and check your blood pressure and blood sugar. So if nothing else, you can donate a couple pints of blood and get access to a little bit of information.
That's good. And, you'd mentioned Variety Care, and I also know that Community Health Centers Incorporated, which is Perry Clausen Clinic and Mary Mahoney Clinic out in Spencer. And if anyone needs referrals to any of those or other clinics in the area, please send us a chat message, and I'd be happy to send you with the resources that Dr. Lund had mentioned, and also any that we might have from some of our partners through the Healthy Community Collaborative. So are there any other questions? Greg, did you have any questions?
Yeah, Dr. Lund, I got one question here. The question is, if I'm trying to choose and you mentioned several ways, it doesn't have to necessarily be an MD, it could be a nurse practitioner, it can be a nurse, it can be a physician's assistant. If I'm a person that don't know, how do I choose the right person, right? What questions would I ask to make sure that that provider would be the right person to give me some advice and help me with some of the things you talked about today?
Okay, so I'll preface it. I left out one group of people that we should not leave out. Osteopaths. Osteopaths in Oklahoma are excellent. Don't let that deter you. You need to get a reference from somebody that's seen them, because when it's scary going in to see a new provider, and you don't know the provider from Adam. You're putting your healthcare. So you need to really, if you talk to a family member or somebody else, they'll usually recommend somebody. If you do have insurance, your insurance company generally will refer you to somebody that they think you'll get along with. I'm a big proponent of trying to have people see people who look like them. Like most of my women, I try to send to a woman provider. I like seeing African American men because there's a lot of things that I can help. Hispanic men I'm pretty good with. People the same age is always good. So if the provider kind of looks like you, if you can see a picture, that would work well for you. The reality is you can't always choose somebody who looks like you. So you've just got to trust trust recommendations of family and maybe nurses. And a lot of times you can actually call their office. If there's 3 providers, the front staff knows who the nice person is. They will tell you, say, oh no, he's having a bad day. No, you might really want to see her. Any other questions?
Yeah, Dr. Lund, one thing that men don't like to talk about, besides erectile dysfunction and all those other screenings that we have to get, the stigma of mental health and the depression, and especially now with what's going on in the world, with what we're seeing, not only with COVID, but with the unrest because of racism and all that, just the stress and the pressure of men in general. And men don't like to go to the doctor, like you said. What do you suggest, and what are your thoughts on the mental health and how men don't often access healthcare for treatment?
Yeah, and that's a real tragedy, and I did allude to that because mental health actually plays a role in erectile dysfunction. And right now, we all are in what's called a situational depression. We have a situation we can't do something about, and that's tragic. Mental health is hard, and especially when you're living with the ongoing stressors of life and finance and this and that. And we don't like to talk to people, but generally, if you can open up to people, and it doesn't necessarily have to be a healthcare provider or like a therapist. It could be your pastor if you go to church. It could be as simple as socializing with other people, like-minded people, or friends. One of the things that I'm doing right now because of this virus, people can't get out and do the normal socialization that they normally would do. So I'm having a lot of patients take walks in the evening. Just seeing that the sunlight actually is an antidepressant. Exercise is an antidepressant. Saying hi and waving to a neighbor is an antidepressant. And then being open to admitting that you've got some stressors. I know I have to decompress, and sometimes you just have to admit that, yeah, I'm not as strong as I think I am. I'm not as, it's not a part of not being a man to admit that you're stressed and you're not sleeping well. It's the better part of valor to go get help early. And so usually trying to, and I'm a big believer in therapy if you can do that, and especially group therapy, and finding clubs of like-minded people is very helpful. That's roundabout because that's not a great answer. I'm sorry. I didn't.
No,
I'm
it is
dissatisfied
because
with my answer.
no, I think it's great because we've seen that, and we know men don't go to the doctor, and especially the stigma of mental health in general in this country, but men especially. You know, men don't cry. You know, men. You know, unless you're bleeding or your arm's falling off, you don't go to the doctor. So,
That's
but
true.
mental health in general, just the depression and the pressures that everybody has. But I feel like men. Sometimes men don't talk to their friends even, you know, because they don't want to show a sign of weakness. So that's why I think just trying to get past that stigma that for generations has been so you know, rampant, to let men know and everybody know that it is okay, and especially at these times that we're living, that it is important to get help and to ask for help if you need it. So anyway. Are there any other questions for Dr. Lund?
I just had a question on telehealth. I know that Centennial offers that, and a lot more hospitals nowadays are offering telehealth. What are the limitations there? What can you see via telehealth? Because I know with COVID and people staying at home and trying to limit their outside activity, that's one good way of getting seen without being present. So.
Well, that's a great question. You know, we just started the telehealth in the last 6 to 8 weeks. I'm surprised what I can do. I'm not surprised about the things I can't do. I can't reach out and touch it. You know, I can't feel it. A lot of times people don't have good cameras, so I can't even see the rash. Those are the limitations. Other limitations is I don't trust people's home blood pressure readings, so that doesn't help me at all. So those are limitations. But you can do psychotherapy. A lot of my, like my nurse practitioner sees a lot of people who are depressed and need to be back on their antidepressant medications. You can do that. You can diagnose some rashes. You can look at a few, go over medications. One of the biggest things I've found that's been very helpful for me in telemedicine is my dementia patients. It really surprised me because I never really am talking to the patient with dementia. I'm talking to their kids. So now I can set up a televisit with their kids, with their dad and dad or mom in the background, go over medications and routines, see the household. And the kid does not have to take off work, or if they're there, they don't have to bundle the demented person into the office. And we have very, very, very good visits with that. So I am going to use that in my arsenal forever. It is, I mean, the stressors on getting somebody into the office that has dementia that I am not going to do anything physical to anyway, so that's one of the pluses I've seen in telemedicine.
Yeah, that's wonderful.
Yeah. Any other questions?
Yeah, doctor, we have another question. What contributes to low sex drive? Was just asked.
Oh, that's a good question because erectile dysfunction is different than low sex drive. Low sex drive is generally depression. It's a symptom of depression. It can be a symptom of, so low sex drive means that you don't want to have sex or you're not interested in sex. Mostly that's a symptom of depression. It can be a symptom of low testosterone. Now, the flip side of that is when you have these T clinics that give these huge doses of testosterone, you know, everybody wants to have sex because they've done the Incredible Hulk on people, you know, so it kind of gets you out of that, but it doesn't correct the thing. So most of the time when you have low desire for sex, that's generally a sign of mild depression, and that ought to be treated either through psychotherapy or, you know, self-reflection or wellness, or, you know, even yoga helps with that. Any other questions? That was a great question. I'm glad somebody asked that.
Greg or Steve or anybody else that's on the call? Anybody else?
No other questions in the chat, but no, that's been great. Any other questions out there?
Mm-hmm. Good deal. Well, that's great. Well, Dr. Lund, we greatly appreciate it. And I also want to thank Greg Jones for setting this up with Centennial Health. Greg, what is the email address or the website that we could get people to, and we'll make sure that that's on.
Sure, I'd love
Go
to share that. So Centennial Health, again, I said we have 4 locations around the city. Here in Oklahoma City, we have an office in Midwest City, Edmond, as well as now in El Reno. You can simply go to our website at Centennial Health, that's all one word, .com. And then obviously our phone number is 405-280-5550. CentennialHealth.com, 280-5550.
And we just had a question. Are you taking new patients, Dr. Lund?
Well, yes. There's a yes and no. Generally, I'm the old guy here, the oldest provider, oldest senior, whatever Greg calls it. I'm generally focusing on people age 62 and up. However, we have providers here that are seeing the younger population in general. And if they got any problems, usually they'll call the old guy in to look at it. But so yes, I am taking new patients. The caveat is that I'm tending to focus on the older population.
Great. Okay, cool. Any other last questions? Well, we want to thank everyone. This was our first time to do a men's health chat by Zoom. So we hope we can start doing these type of things until we can start getting back together and do live lectures with Dr. Lunn and some of our other providers out in the community. But we hope you enjoyed it. You'll look on the chat. There's also information so you can contact community health centers, Centennial, and then Steve's going to put up the Lynn website, which is www.lyninstitute.com. And the Lynn Institute, not only on our group, we are the not-for-profit parent company for Lynn Health Institute, which does pharmaceutical research, and they do all types of testing for vaccines, different types of medicine, medications, and they do all types of studies. If you're interested in any of the studies, that includes diabetes, sleep disorders, sickle cell. There's all types of programs that they're doing through our subsidiary company, the Lynn Institute. If you're interested in that, please let us know and we'll get you some more information. Again, I want to thank Dr. Lund for taking the time from his busy schedule to do this, and we really appreciate it and hope we can do more. Greg, thank you. And I want to thank all of you for joining us. And if you liked what we're doing and like to see other topics that we could see if Dr. Lund could to do in the future, please let us know either by chat or you can email us, let us know. Thank you again for your time, and I hope you all have a great week. Thanks for joining us.